Welcome, everyone. As we know, we have our great presenter here from Down Under, Gary Turnbull. Thank you for joining us again, Gary.
It's a pleasure.
Please go ahead and start whenever you're ready.
Terrific. Thank you, Denise.
You're
Welcome,
very welcome.
everybody. Good evening, and welcome to this evening's presentation. And as I say that, I'm looking out the window right in front of me. It is sunny blue skies, 11:30 in the morning in my part of the world, and about 25 degrees as we head into our summer. So I can anticipate a very different reality for all of you. In this evening's webinar, we're going to focus on financially related complaints. Where do they come from, and what can we do to minimize the risk of them happening? And we'll talk a little bit about the impact that they have on us as well. Before we do launch into new content, though, part of the learning cycle that we value so much at Lincoln Institute is the importance of reflection. So the modules that you're doing each week, of course, are your instruction. And then these webinars represent such a great opportunity for reflection, revisiting content. So as a starting point, I'd make the invitation to everybody present. If you had a win or some success that you would like to share based on the learning so far from the Leading Edge program, if there are any questions at all that are outstanding for you based on the content that you've consumed so far, and or if there are any ongoing or recurrent challenges where you feel like I'm really not achieving what I'd like to within a particular facet of these non-clinical skills and competencies, I'd love to hear from you. So please, open floor to start with. If people can, and I appreciate if you're sort of tucked up in bed in jammies, well, that's a little bit of a problem because we are going to do breakout rooms a little later. But if you could, I'd love for those of you who can, just to switch your cameras on, just so we can all say hello to each other. There's a social element to learning. Thank you, everyone. It's lovely to see. Let there be light. If you are enjoying particular wins, then there are likely others who are. If you've got a particular challenge, there are likely others who are. So again, I would encourage, if you can, and I understand that that not everybody may be able, but if you can, be lovely to see you all. And it sort of also opens that doorway for anyone who'd like to just to unmute. Any successes or wins, they're all important, and it's good to hear these stories. Anyone who's got a question or an ongoing challenge, I'll just pause for a minute and just see if there's anything anyone would like to share. Christopher.
Thank you very much. I've been using the 3 questions technique a lot more to engage with people, just when we engage them occasionally in the clinic, like not just saying hi, but actually stopping, asking a question, following with 1 or 2 more questions, and just trying to deepen that sense of relationship and trust. And it seems to be elevating the group as a whole over time.
Yeah. Fantastic. So just to clarify there, Christopher, are you referring to like that rule of 3 type concept?
Yes. Yeah.
Yeah. Well done. Thank you for sharing that. And I was going to say, what a simple technique for developing our ability to listen, to understand. Of course, anything that's easy to do is also easy not to do. So anything that's easy is always a trap. And from the context of the exam or consulting room, developing that trust and rapport, that likability with your client is so powerful. And from a negotiation, this is important as well, from a negotiation perspective, because every time you're making a recommendation and having a conversation with a client, it is a form of negotiation. And one of the principles of negotiation that can be very helpful is what's called the power of overlap. And the power of overlap is where there is common understanding and common knowledge between you and your client. So when you talk about them, and your client tends to be their favorite topic of conversation, even more so than their pet, capturing any information about them and keeping that on record is very, very helpful. For those of you who have or who've done this, asking a client, and an example that I recall was a client who had a hip replacement, and several months later, tell me, how's the new hip going? Just you could see their face light up. Like, you remember that? Now that's recorded in the history, but just when you build rapport like that, that's when you really create raving fans. And of course, that comes, Christopher, rightly through our ability to listen and ask open questions so we get inside the mind of our counterpart. Thank you for sharing. More have joined since we started. We're just doing a little bit of sharing any wins, any successes, any outstanding questions relating to non-clinical competencies, any ongoing challenges. If you can turn your camera on, I'd love it. It's so nice to see you. To put a face behind the name makes it so much more real. If you can turn your camera on, we'd love you to. And we are going to break out into breakout rooms in the middle of this presentation as well. And that's going to require some interaction with your colleagues. Anyone else want to share? Anyone? Wins, challenges, questions? You're a very quiet audience this evening. Must be the end of a long day. Nothing else?
Any surprises during the midpoint survey or questionnaires?
Thank you, Denise. Good question. I'm going to assume you're all just happy then. All right, let's share my screen, and let's move into this evening's content. Okay, so just focusing on this topic of financially related complaints, and I want to share with you some data. I know Michael has also shared some data. We've conducted 2 surveys across 12 countries. This data specifically is from the second survey, which involved, it says Australia and New Zealand, but there was actually 12 countries in this one in 2021, including Canada and the US. And this was fairly repeatable on the 2018 survey as well. And the one that or the 2 data points I want to highlight here, I routinely encounter anger, abuse, or deliberate emotional manipulation from clients relating to the cost of veterinary care. And you can see that over 50% of respondents answered in the affirmative. And to be clear here, recognize that emotional manipulation. Sometimes it might come across not as intended by the client. It might be subtle. It can, however, have a profound impact on us. And some of the comments that as an example, comments that I remember in practice would be things like, oh, well, I guess we just won't eat this week. As a comment from a client attached to a recommendation and the cost associated with that. Or and remember, I was a practice owner as well. Oh, well, we've already put your kids through high school or college. These kind of subtle jabs that do have very much have an emotional impact on us. So we're not just talking about the very obvious emotional blackmail, what I can't believe this. Do you even care about animals? All you seem to care about is money, or raising voices and that sort of thing. Just those subtleties that really, even just some general commentary from clients can have quite an impact on us. So we're not necessarily just talking about anger and abuse, but those those comments that slip in and just make us often quite uncomfortable, often feel fearful or guilty. So the next statement we posed was, please quantify approximately how often this anger abuse or emotional manipulation from clients relating to the cost of veterinary care occurs in the course of your work. So I just want to emphasize here, this was just relating to cost of veterinary care, not patient outcomes, not patient or client experience, just cost of care. And you can see there that by far in this particular survey, the runaway most common response there was at least once weekly. So I'll be really curious, and this does seem to vary a little bit culturally. I've experienced significant variations here based on the particular country that we're presenting in. I would be really curious if everyone would be happy just to type into the chat box, and Denise is just going to watch this one for me. How often do you encounter some kind of manipulation, anger, abuse based on cost? And just a one or two words, weekly, fortnightly, monthly, twice a year, just a word or phrase that would best describe your experience. A few times a week, actually. Denise, I've got this in front of me. Yeah, weekly, a few times a week, weekly. Okay. So that seems to be very much in line with the data that I'm presenting here. And that is interesting in that I think culturally, probably our countries are very, very similar. So that doesn't really surprise me. And again, in this survey, Canada was included in the research of the sample set that we collected data from. And here's something that is really important. We've all had that experience, and for most of you, it seems like it's about weekly. On any given day, you could have interactions with 10, 15, 20, 25 clients or more, particularly if you're consulting, and all but one are respectful and appreciative and grateful, and just one makes that complaint. Just one raises this issue around cost.
Excuse me.
What happens when we leave the practice? What's the one case that stays on our mind, or that we ruminate over, or that we have an overly emotional response to? Why is it that we can have 29 positive interactions and they just don't offset that one negative? And it relates to the difference between, effectively, I've seen it described as our red alert system. So, and this is something from a sort of evolutionary perspective, the fight, flight, freeze reflex or response is very, very deeply rooted or hardwired to us. Research suggests that in fact, the amygdala hijack has about 150,000 years of wiring to it. And so when we have that triggered response, when the client does demonstrate this anger, abuse, or manipulation, it creates the physiological, the emotional, and psychological response of a potentially life-threatening situation, even though, of course, in our modern world, these things are not life-threatening. It's that self-preservation and protection reflex that is hardwired to us. And so it really leaves a mark. What we don't have, we are not wired for an equivalent green alert system. So when that client says, hey, thanks, that was wonderful, it just doesn't have the same impact for us emotionally, psychologically. We don't have the physical response, we do have a physical response and a psychological one from a point of view of neurohormonal. We do release oxytocin, but it just doesn't have the same impact as the cortisol and adrenaline release that goes hand in hand with the fight, flight, or freeze. So don't underestimate, and it's important to recognize the impact that these interactions can and do have on us. And in fact, we can see here when a client rejects my recommendations or questions my ethics, it makes me feel a lower sense of self-worth. Now, this is just a client saying, no, thank you. This is not anger, abuse, manipulation, just a client declining a recommendation. We've got nearly 50% of veterinarians saying that lowers their sense of self-worth. So what impact is something far more significant in terms of an interaction with a client than just a no to our recommendation. What kind of effect is that having on us, particularly if it's happening on a weekly basis and therefore, 40, 50 or more times a year? And that can really weigh heavily on us in terms of our resilience and our well-being. So with that, let's talk now about how can we approach financially related complaints such that we understand the basis of them and how we can minimize them. And in order to do that, I want to present this through the lens of trust. Because when you break it down, interpersonal conflict, whether it's financially related or otherwise, it occurs typically where there is some perceived breach of trust. So what I'd like to do is unpack trust through the lens of financial interaction between yourself as the clinician and your client to identify where we typically go wrong, where we might go wrong, and how we can minimize our chance of doing that. So I'm sharing this presentation or presenting this through the lens of what we call the 4 pillars of trust. And the 4 pillars of trust do appear through the curriculum of Leading Edge. So if you haven't encountered this yet, you will, in a somewhat different context to how I'm presenting it this evening. The first pillar of trust is credibility. To provide a simple definition of credibility, what we mean there is know what you're talking about, and when you don't, speak up. So that would be a basic kind of principle there of what we mean by credibility. We've all got a reasonably good radar for when people are making things up. And so long as we qualify it, there is no harm in saying, I don't know. In fact, saying I don't know in the right context to this very point builds credibility. I don't know what's going on with your pet yet. I do know the next steps we need to take to find out. So articulating when we do know and when we don't is very, very important. Now, when it comes to this pillar of credibility as it relates to financial complaints, there are 2 elements to this. One is the words that we speak. And then the other is about the other 93% or thereabouts of meaning. As most of you would be aware, and again, this is quoted in the Leading Edge content, the landmark work that was done around communication and understanding of meaning, and the recognition or the identification that the words we speak account for less than 10% of our overall understanding of meaning. And so much relates to our body language, and so much, and that includes our posture and our facial expression and so forth, and so much relates to our tonality of voice and our tempo, the way we actually deliver the wording. So when it comes to credibility, there are 2 pitfalls. One would be perceived indecisiveness. Perceived indecisiveness. And then the second is price discomfort. These play out in very different ways, so I just want to step through each of them. And I'm, again, supporting this with some of the previous work that we've done. I simultaneously provide different levels of care in my treatment recommendations and leave the owner to decide what they prefer. And we can see an overwhelming majority, 84% of veterinarians answering in the affirmative. Now, we are very, very clear on this, and I want to re-emphasize this point. We are not for one moment suggesting or advocating at Lincoln through the Leading Edge program or any other forum that we don't give clients options and choice. We are not saying that. However, the way we deliver that is important. And if you look at the psychology around choice, as we front load an interaction with all of the choices, we could do A, B, C, or maybe D. What would you like to do? Two things happen. Number one, it does make it more difficult for the client to arrive at a decision. So often they will defer to, we won't make a decision yet. And there's a level of overwhelm. This is kind of this paradox of choice. And the second is that having multiple choices escalates expectations. And, you know, it was interesting. I saw this play out just 2 weeks ago. I was presenting a leadership program in New Zealand, and a veterinarian, we were at morning tea break, and a veterinarian was staring at what was on offer for morning tea and just couldn't make a decision because there was savoury and there was sweet. And within the sweet, there was with strawberry and without strawberry. And I just said to this particular colleague, I said, Carly, what would happen if there was only one option? And she smiled and she said, I'd be eating by now. And it was interesting to see this at play in real time, just the perplexed look, I don't know. Because now I've got options, it's harder to choose. And then what happens after the event is, maybe I should have had savoury. That probably wasn't the best choice. And I probably should have had the strawberry option if I did have the sweet, and I didn't. So we've got to handle choice carefully. We do say, look, there are options here. The best way forward is. And for many of you, I'm sure, you will have seen clients that are newer to your practice, or maybe they're attending for a second opinion. And you will hear something along the lines of, yeah, look, the veterinarian we saw previously, they were really nice, but they just didn't seem to know necessarily what they were talking about. They just seemed unclear. So understand that if we present as we can do A, B, C, what would you like to do? It can come across, and that is with best intentions, I recognize that. That can come across to the client, can have the impact of a perceived lack of competence or a perceived lack of credibility. In here, you decide because I'm not really sure. And an obvious question from a client might be, well, what would you do in this situation? Because at the end of the day, you are the perceived expert in the room. So there can be this adverse reaction where the client is saying, what am I paying for here? You know, you're the veterinarian, you're the expert, you're the doctor. Why aren't you telling me what I should be doing or what we should be doing in this situation? So just be wary that by providing options, not only do we lead to confusion and an escalation of expectations and then some level of dissatisfaction, it can actually come across as a lack of credibility. That would be point number one. Now, the next one is, I never experience guilt and or fear when discussing money with clients. And again, quite a significant majority, 72%, answering in the negative. In other words, what they're saying is, I do experience some fear and or guilt when discussing money with clients. And interestingly, I was presenting this to a group in Victoria just a couple of months ago, to a large group of practices. And the chief medical officer, when I presented this, and he was a very well senior and well experienced clinician, he said, Gary, I reckon that's bullcrap in typical Australian style. And I said, really? And he said, yes. He said, I reckon it's way higher than that. I've been at this for over 25 years and I still get uncomfortable. I still experience guilt and sometimes fear when I'm discussing money with clients. So who knows? Maybe it's higher. It was an interesting anecdote from someone who had a very, very high level of competence and confidence. Here's the thing. When you're interacting with a client, there is a difference between what you can perceive and what your client can perceive. If you are genuinely experiencing fear and or a sense of guilt, that will play out, that will be evident in your body language, your tonality, your tempo, your facial expression. And again, through evolutionary psychology, we have been developed very well, developed sophisticated ability to look for evidence that we can trust somebody. So if you're feeling guilty or uncomfortable, your client will pick up on this. Remember that rather ironically, in the consultation room or the exam room, there is one person who can't see your face, and that's you. So your client or clients can see your facial expression and you can't. So you're not aware of that. Equally, your tone of voice, your tonality, the reality is that for anyone, and we all have, you've all heard your own voice being recorded. And I'm sure you all have thought, oh no, surely not. That's not me. Could I possibly sound like that? There is a significant difference between how we hear our own voice and how others hear our voice. And that is because we are all tone deaf to ourselves. So your client is experiencing a different experience to what you are. And we can be blissfully unaware of the guilt or fear or discomfort that we're conveying to our clients because we can't see it and we can't hear it. So kind of two things about this in terms of how do we tick the credibility box? Number one, as has been presented in other modules and other areas in the leading edge program, the more we can be, we want to be partners with our client in the decision making, but also be a leader, recognize that we are in fact the perceived expert in the room. So we do have choices here, or there are options here. Let's start with what's best, and here's why it's best. And then if the client declines for any particular reason, then we can move on to next options. But being clear and direct and confident in our recommendations helps to overcome that. Oh, they didn't seem to know, they just seemed indecisive. I'm not sure they knew what they were talking about. So that is number one. And number two is just kind of the mindset that we bring to the examination room or the consultation room. And I just want to share this concept with you, this relationship between our competence and our confidence. Because confidence without humility breeds blind arrogance. And that can be, for example, in fact, we probably all fall victim to this at certain times, particularly as we become more competent and more confident with time, and fail to recognize the very many unconscious biases that we are subject to: pattern recognition bias, recency bias, confirmatory bias, attribution bias. There's about 100 or so. And they do have an adverse impact on our decision-making capability. Probably all being guilty of something like as that lame three-legged walking dog comes through the door. Oh, that's a cruciate. Why? Pattern recognition. I've seen this so many times before. So there is a risk that there is a place of overconfidence where our confidence is exceeding our competence to a point of taking cognitive shortcuts that can lead to errors in decision making. The opposite is humility without confidence can lead to debilitating doubt, and that area of imposter syndrome, where our competence greatly exceeds our self-confidence. And our confidence is kind of like how we feel about our ability to do the task as against our competence, which is in fact our actual ability to do the task. So the sweet spot here, we certainly don't want to be arrogant. We don't want to be falling victim of unconscious and conscious biases. At the same time, we don't want to be stuck in kind of analysis or debilitating paralysis where we just can't make decisions. So the sweet spot is this zone of confident humility where our competence only exceeds our self-confidence by a little. And operating in confident humility is where we recognize we don't have all the answers up front, and we never ever will have all the answers. However, we do have the resources within us and around us, which includes referral at times, because it can be beyond the capacity and the capability of ourselves and our team. But recognizing that we do have the resources and the potential to take a case forward in a logical and meaningful manner, not have all the answers, because we're never going to achieve that. So being clear and decisive with a level of authority, so that because we are the perceived expert. And in fact, there's one of the modules fairly early in the program that Dr. Chris Goff delivers, where he talks about who you need to be. And he talks about how we feel about ourselves and how we come across within the exam room. Okay. The second one is reliability. Now, by reliability, from a perspective of trust building or trust erosion, what we simply mean here is do what you say you're going to do. Reliability is all about do what you say you're going to do. And the real pitfall here is a lack of attention to detail with financial estimates. And this is both common and has a costly impact for our profession. I provide written estimated costs for treatments, and these are always accurate and inclusive, meaning I never have cause to apply a discount to the final amount owing. And you can see here, and there are two elements to this. One is providing written estimates for cost of treatment, which is that kind of making sure we're very clear. We'll talk about that when we talk about openness, and then always being inclusive. You can see there around about 50% of veterinarians who are either not providing written estimates, so they're not being really upfront and clear, or they're applying discounts to reduce the final amount owing. And this is the kind of the worst case scenario here is when a client asks, sure, doc, that'll make sense. How much will that be? And you blurt out a number. If there is one thing to take away is never, ever just say a number. Because I'm sure all of you will agree that more often than not, when you say a number, you end up regretting it. Because when you do sit down and create an estimate, which of course we would call a treatment plan or a diagnostic plan, when you sit down and take the time to actually create it correctly, you almost invariably find that you underestimated. And when you underestimate, you either have to now disappoint the client or you have to reduce the bill accordingly. Now, I'm not sure if there is a recognised number in Canada. Certainly in Australia, there is a recognised benchmark that missed fees and charges accounts for about $50,000 per full-time equivalent veterinarian per annum. And in the US, the number is closer to 60,000. So this kind of inaccuracy and not being reliable, not doing what we say we're going to do, and then getting boxed in and having to reduce the bill, discount the bill, or leave items off to keep the cost managed, has a huge impact on the commercial sustainability of our profession. Huge impact. So if we take this one step further around this, do what we say we're going to do, because that's what reliability is all about. I want to just share this relationship with you around expectation management. This is the relationship between what we promise and what we deliver. Now, first up, upper left, if we don't promise something, we don't deliver it, it doesn't really exist. So we just put that as a neutral experience. We must understand, and this is the point of this conversation, is if we overpromise and under-deliver. So if we promise something and we don't deliver, that is going to lead to client dissatisfaction. In other words, if we set an expectation around the cost, and that's the promise, and then we deliver a higher cost, then that will lead to a negative experience for the client. And when I first graduated back a few years ago, when I first graduated and went into business, the general consensus or the saying was, if you had a disgruntled client, they would go and tell 20 others. Well, of course, we now live in a world where a disgruntled client will go and potentially tell about 2 billion others. So the stakes here are very high if we promise something and we fail to deliver. So what we want to make sure that we do is, so what's the fix here in terms of being reliable? Well, as a minimum, we need to at least deliver on what we promise. So we need to have accuracy and consistency there. We need to be upfront and say, here's the cost involved, and then not overrun on that without appropriate future pacing for the client, which we'll talk about in the next pillar of trust. Very, very important that we at least deliver on what we promise. Now, that is a neutral experience. When you deliver on what you promise, that's neutral because that's what the client was expecting. And when the magic really happens for your client experience, whether it be within the context of financial expectations or otherwise, is when you deliver on the things that you didn't promise. Now, there's a whole module dedicated to freeing yourself with great estimates. And we go into detail there to create a strategy to effectively create this situation for yourself, where if anything, the default is it actually ended up costing a little bit less than what we expected. And now we have under-promised and over-delivered. Another term we will use for that is surprise and delight. So when you say, here's what it's going to cost, and that's what it does cost, that's neutral for the client, that's okay. But when you can actually come in a little under, when you can say, there is some variability here, there are some potentially unknown elements. So let's be clear that we could be up here. We've actually come in below that. That's when we really build trust. Now, what we want to do, just a 5-minute breakout here, is within this concept of surprise and delight, or how could you and your team, as veterinary professionals, how could we surprise and delight our clients to really ramp up the perception of value? Because we know that all the research suggests that when a client declines due to cost, it's often not about genuine affordability, it's about perception of value. So what could we do in practice to provide an experience where we actually under-promise and over-deliver, or surprise and delight to build trust? And I'm going to share a couple of examples when we come back for your contemplation. But before we do, we're just going to break up. We'll spend 5 minutes only in small groups, just talking about how could you surprise and delight your clients within the context of day-to-day practice. How can you under-promise and over-deliver so that not only are you reliable, but you're actively building trust and building a raving fan base? Denise, I'll let you take it away.
All right, great. So we'll head into the breakout rooms momentarily.
Okay, welcome back, everybody. Would anyone be brave enough to go out on a limb and share any suggested strategies or ideas with this concept of surprise and delight? Because in practice, we kind of tell the public, we tell the world what we do. We talk about our compassionate team of caring individuals, and we talk about our world-class facilities and our state-of-the-art diagnostic equipment and our convenient off-street parking and all the rest of it. And when we do those things, we tend to think, wow, we did a good job. Remember, for the client, that was just a neutral experience because you just delivered on what you promised. So any thoughts on how we could surprise and delight our clients under promise and over deliver. So we really ramp up that trust, that perception of value, and the sense of shifting the focus from money to the experience they had. Any ideas?
I can share. I like to, especially when I'm first meeting a client and their pet, especially if I notice, which is pretty much all the pets, that they're nervous or fearful. One of my first questions is just like, hey, how have things gone in the vet before? What really works for your pet? Especially if I'm going to be examining them, giving them a vaccine, something like that. I ask, are there treats they like, or do they, those kinds of things. And so many clients are absolutely shocked that I would even ask that. Sometimes
Yeah,
they're
well done.
sometimes they're like, oh, he does really well with treats, or he does well when I hold him, or actually I'd rather not be a part of it. All of those things, I just find letting the person actually advocate for their pet. They know them best. I've spent literally 5 minutes with them. How am I supposed to know how your dog or cat's going to react? And so
Yeah.
opening that dialogue, especially right off the bat, I think just changes people's mindset already. They're like, oh, you actually care. You actually are listening to me. And not only that, I'm a partner in this relationship.
Yeah, nice. Well, Emily, thank you for sharing that. What a lovely, clearly you're seeing it in your client, the surprise and delight elements. Like, really? What? You're asking all this? Well done. Nice one. Thank you. Anyone else? Any other something you might do, or something that might be able to be done? Not necessarily just as an individual, but also at a kind of at a team level within your respective practices.
I can go.
Thanks,
Um,
Kelly.
yeah, something that I normally do for with the patients who are on like a chronic disease patients, whether they're seizures or diabetes or just generally requiring long-term management, I check in with them every few weeks just to see how things are going. And other things that I notice the clients appreciate is when patient is presented by a spouse or husband who kind of doesn't know anything about what's been going on. And so I would send them a summary of an exam to the primary caregiver, and they seems to really appreciate what's been done and what was found and whatnot.
Kelly, lovely. Thank you for sharing that. One question. You mentioned with a chronic long-term patient, you'll check in every few months and just see how they're going. Can
Yeah.
I ask, do you tell the client up front that you're going to do that?
No, I don't.
Bingo. Thank you. That's exactly what we're talking about. So when you say if you were to say, you're not, if you were to say, now I like to keep a close eye on my patients, so I'll be in touch. I'll keep in touch every couple of months to see how things are going. I mean, that's still good, but that takes the magic away, because now when you do it, you just did what you said you were going to do. So we're back to a neutral experience. And furthermore, if for some reason you got overly committed or just simply forgot, we're all human, then you set yourself up for the overpromise and underdeliver and the disappointed client. So that's, Kelly, a great example of surprise and delight. I'm going to do something without telling you that I'm going to do it. So that's kind of the principle that we can really kind of help to not just improve the perception of value in the client experience, but also shift their focus away from money and towards everything else. Just to share with you, this is an example beyond our own profession. I travel to New Zealand regularly to speak over there, and when I arrived at the Movenpick Hotel in Auckland, I was walked into the room, and there was this beautiful platter of desserts that you can see there. Not so good for my health, but nevertheless, had a lovely emotional impact. And you can see the handwritten card that was handwritten, personalized, that went with that. So you can imagine. Am I worried now? Am I thinking about how much is this room costing per night? No, I'm just enjoying the feeling of feeling special and important. An example within our context, above and beyond what Kelly and Emily have shared, this one is one that can work very, very well. And that's when a patient does come in for the day. And some of you may be doing this already. Don't tell the client you're going to do it. Don't tell them up front. Take a really nice photo, cuddling with one of the team, and then sending that personalized message after the procedure has been completed. Just from the pet's perspective, letting them know that everything's okay. Has the smallest things have the biggest impact. So one little tip there might be an idea to take the photo before the procedure, particularly if it's going to be dentistry. They don't look so good after. And make sure that they're well and truly safe in recovery. But these have a profound impact. So what can you do to really surprise and delight your client? Often it doesn't relate as much to clinical care as to the client experience. So what else can you do? Okay, now to round it out, the third pillar of trust is that of openness. And by openness, what we're talking about here is transparency, particularly as we look into the future of what is often highly complex and unpredictable. There is, of course, an element of unpredictability to surgical cases, but particularly our medical cases and our diagnostic workup, our hospitalized cases. They are highly complex, they're unpredictable, and there is a level of ambiguity to it. And what we've got to recognize is that at least half of us as veterinarians, more than half of us are an amiable social style. We're people-oriented, we're high empaths, we're passive, we're introverted, and as a result, we are highly conflict averse. And so we will, part of the human condition is we tend to follow the path of least resistance. And so often we're avoiding being upfront when it comes to those money-related conversations. It's also the reason why we do things like take a quick x-ray. Oh, well, I'm not really sure that how much value I'll get out of this, and I really don't want to have that conversation with a client, so I'll just do something and I won't charge for it. We've really got to be on the front foot here, and there are two elements to openness. It's framing the value proposition and future pacing the client to avoid unexpected overruns and bill shock. So again, I'll repeat those two. Number one, when it comes to openness, framing the value proposition, number one, and number two, future pacing the client to avoid unexpected overruns and bill shock. To that discomfort, I am uncomfortable discussing money with clients and worry about causing them expense. You can see that there's a solid proportion of veterinarians for whom that is true. And of course, what's interesting here is we fundamentally understand the notion of expense, but expensive is so subjective. This is telling as well. I never provide professional service components while intentionally not charging for them in order to make the final invoice more affordable for the clients. This is a real concern. That 70% of us, or in this study at least 70%, are saying that they do intentionally not charge for things to make the final invoice more affordable. In other words, we're not being upfront on the front foot, and as a result, we then have to modify the bill because we get ourselves boxed in. So with openness, I talked about two things. And that was framing up the value proposition and future pacing. So what do I mean by that? Framing up the value proposition. Let me give you an example. Let's take the grade 4 out of 5 lame dog, for argument's sake, and you palpate the limb that's clearly dysfunctional. And you cannot palpate any fractures. You cannot palpate any instability that would suggest luxation or subluxation. There is an area that's painful, but structurally you're not picking up anything major. Now, how do we be on the front foot with that and frame up the value proposition? The way to do that is. The only way for peace of mind here for you. The only way that I can be certain about what's going on would be to take x-rays. The good news is I can't feel anything major. I can't feel any fractures. I can't feel any instability. Can't feel a dislocation. However, there are a number of sinister possibilities that I simply can't rule out with a physical examination. I am hopeful that on x-ray we find nothing other than soft tissue swelling. That would be a great outcome. Hopefully that's the case, and if it is, what we're going to do, we're going to start some anti-inflammatories, we're going to use ice, and we're going to rest, and then we'll recheck and see how things are going. If there is in fact something more sinister going on, and there's a couple of possibilities there, then I will call you straight away so we can discuss the implications of that and what sort of the next step plan looks like. So framing the value proposition here, what we're framing up is peace of mind and certainty. Because if we don't, then the risk is we kind of avoid being really open and framing it up well. The risk is when we say to the client, look, the x-rays were relatively normal. Oh, well, that was a waste of money. Then we didn't find anything. So framing up the value proposition so that we set the client's expectations for what is in fact good news. And then with the future pacing, we have, again, we will recognize that the ambiguity and the complexity that goes with, for example, particularly medical cases. So we need to be very much on the front foot. If you were to see a case on day one, and it's, let's say, it's an acute abdomen and it's pyrexic. Well, we've got to be really clear as to what the costs are going to look like for today. This is what we're going to need to do immediately. We're going to need to run full bloods and biochem. We're going to get some urine. We're also going to do some imaging. Bloods are going to tell us about kind of function. The imaging is going to tell us about structure. That's going to start to form a picture for us. At the end of the day, we may or may not know what's going on. We're also going to put them onto IV fluids because they need that right now. They're not eating, they're not drinking. Here's what it's going to look like for today. We cannot stop there with the financial conversation. We need to then paint the picture tonight about what tomorrow is going to look like and what it might look like the day after and the day after and the day after that. And it does, of course, get increasingly ambiguous, but we're doing the client a real disservice if we stop short and say, here's what's involved for today without any sense of what it's going to look like. And we call this future pacing. Future pacing your clients, setting them up for what does tomorrow look like and what does day 3 look like and what could a day 4 look like if we could get to a day 4. So really mapping it out, being very open and transparent and mapping it out up front rather than playing catch up, because then clients start to say, hang on, how did we get here? We never talked about this, and we've got this risk of overrun and bill shock. Okay, last one, final one is motivation. By motivation, what is the intention here? What's the underlying driving force? And this is less about the general public and this is more about ourselves. Because as veterinarians, we frequently second guess the client's assumptions around our motivation. And we tend to overestimate what they're thinking in terms of money, cost, profitability, and so forth. And where this affects us the worst is when there is either multiple recommendations and or an unexpected recommendation. So an example would be you examining a patient that's presented for vaccination, and then you find that it's got a fractured maxillary carnassial tooth. The client said, oh, look, they're wonderful. I've got no concerns at all. Now you're having to have a conversation about that clinical presentation. And the risk is that we can feel like, oh, what if they think I'm over-servicing? What if they think I'm just motivated by money? What if they think I'm being pushy here? And this is, my motivation is wrong. When in fact your motivation is all about being a patient advocate and providing the best and most accurate advice you can so your client can make an informed decision. And another example might be something like, let's say, you're presented with a senior feline patient. And we know that our standard of care, based on our practice policies, our standards of care, our values, we know that at a certain age we should start routine blood pressure monitoring. And your client is not going to walk in saying, "Hey doc, I think the cat's got hypertension." That's got to be on us, and we can be held back because we've got this concern that if we mention this, the client's going to create distrust because the client's going to think we're motivated by money. When in actual fact, that of the available evidence, that's far less common, and it's more an issue or hang up for us and not for our pet owning public at all. And to this point, I'm concerned about how clients will react to me when I present them with an expensive estimate or invoice. And of course, what is expensive? It's completely subjective. And who are we to guess what a client can afford and or is willing to spend? So we just make that point, that is completely subjective concept. But in terms of our motivation and second guessing ourselves, well, if you actually look at the research that is available, 75% in this particular study, 75% of owners agreed or strongly agreed that veterinarians make recommendations because they feel it is good for their pets. Only 10% agreed or strongly agreed that recommendations are motivated by profit. So here we are second guessing ourselves and perhaps feeling fearful or guilty, which sort of goes back to that point about credibility where we started, and not being, questioning our own motivation when in fact the client is not questioning it at all. And two strategies that can help to address, for yourself more so than your client, your motivation is the power of legitimacy. And of course, in the leading edge content, we talk about the power of legitimacy of the treatment plan or the diagnostic plan, aka an estimate, where we actually build in perception of value, show them everything that we're going to be doing and why we're doing it, why it's important. Because once it's presented as a proposal, once it's a document, it's no longer negotiable. It's simply, it's a fact. It is what it is. And it takes negotiation off the table. Equally, the patient report card, the concept of providing some kind of report that comprehensively defines and describes our findings, equally taps into that power of legitimacy. And it just helps to alleviate that second guessing that you might be experiencing about how the client is interpreting your motivation or what they think you're motivated by. Because as we know, for them to think you're motivated by money couldn't be further from the truth. So just those sorts of tactics or strategies to tap into power of legitimacy. Okay, so to wrap up, we're just slightly over time. Credibility, reliability, openness, and motivation. If we're aware of those four mechanisms by which we can build or erode trust, and take those strategies to really avoid, or at least avoid is unrealistic, but at least minimize the chance of financially related complaints taking place. Okay, Denise, I'll hand back to you.
Thank you very much, Gary. That was very insightful. Does anyone have any questions before we end the session for this evening? There's one online. Do we think this has changed with rising inflation? This study was done in 2002, nearly 25 years ago.
Yeah. Do you know, I really appreciate that in that there is such limited data around the perceptions and the desires of pet owning public. And in fact, to that end, we're just about to embark on a research study with Boehringer to in order to look more deeply at the perceptions of veterinarians and veterinary professionals and the perceptions of the general public and how they correlate. So we hope to bridge this gap in data soon. What I would say, I mean, with inflation and rising costs of living, we would absolutely expect, and I know for a fact that in Australia, New Zealand, and I imagine in your part of the world too, veterinarians will describe, I'm seeing more no's than I normally would. I'm seeing more clients decline than maybe I did 12 or 18 months ago. I guess what's important, and we've got no judgment here, that's that is a sign of the times, and that won't last. It will change as these things go through cycles. What I guess we're trying to say here is don't let that dictate your clinical decision making. Very, very important that we stick with, we're not financial planners or financial experts. We're not, I think with the exception of Kathy, we're not psychologists. We're veterinary health professionals. So we need to stick to and focus on our expertise, and that is being the advocate for the patient. And so in this time when there will be a heightened sensitivity to costs, all the more important that we adopt these strategies to minimize complaints and so forth. So yeah, I would say that it's probably more prevalent now with a cost of, I'm not sure if cost of living crisis is fair. That might be hyperbole, but certainly rising cost of living. It's going to have an impact. So all the more important that we adopt these strategies and really be on the front foot. And remember, the cost is not your fault. You are there to serve and move heaven and earth to provide the very best care to your patients. And you, two comments always to keep in mind. I might have said this last time. Remember, you didn't give them the pet, you didn't make it sick. So let's focus on patient advocacy. If the client says no for whatever reason, then let's make the next recommendation the next, and so forth. But yes, I would suspect greater sensitivity right now with cost of living. Any others?
That's great. Thank you, Gary. I do have another one. I believe as a pet owner and horse owner, knowing that the costs are before making decisions is helpful. No surprises. Thank you, Kathy. Any other questions? Well, this is great. I don't see any hands up, and I don't see any further messages in the chat. So I want to wish everybody a very lovely evening, wherever you are in the country. Have a great one, and we'll be in touch soon with the next webinar date.
Thanks, Denise. Thanks, Kathy. Thanks, everybody. Lovely to see you all again. All the best.